we still have other stories making headlines for you at this hour. Now, following the launch or the revamp of the Universal Health Coverage Plan, the Ministry of Health has agreed with other stakeholders to address issues bedeviling human resources for the health sector. Now, the head of public service and the CS for public service have called on the health workers to serve Kenyans diligently despite the existing challenges, the human resource challenges for the health sector. And of course, the health sector is very critical in achieving universal health coverage, as Beldin Waleula now explains.
Human resources for health has been a persistent issue, leading to numerous strikes among health unions. Kenya is still crippled with a shortage of health workers despite hiring pledges. The Senate Health Committee Chair for Health Jackson Mandago pointed out that counties are cash-strapped and unable to hire more health workers.
So what happens to a nurse who has graduated from KMTC for the last 5 years and has not been employed anywhere? And then the skills fading away. Why can't we keep these people in a working environment in terms that we can discuss and work on a framework where finally they will be absorbed as permanent and pensionable?
The government insists that the shortage will be dealt with by the formation of the HRH Advisory Council and calls on those employed now to serve Kenyans effectively.
It is important, as a sector, we must solve this issue. What I'm sure of is that this time round, human resource for health, we are going to resolve it.
Health union leaders who are also signatories of the Kericho Declaration on Human Resources for Health in Kenya say the government should ensure the workforce is motivated to avoid industrial action.
We are happy that the President and the government has set up the Kenya Health Human Advisory Council, which is supposed to play the role of what the Health Service Commission that we initially envisaged is supposed to do. It's a body that's supposed to streamline how healthcare is managed. Health workers are managed across the counties. So we are happy that the head of public service was here, and we have agreed on a 17-point agenda on certain things that we are going to undertake to do. The key of them is that we are going to promote all the doctors and healthcare workers who are due for promotions.
We have a dire shortage of health workers, and that is why, as we are today, we cannot actually meet the expectation of Kenyans in terms of UHC, because it's the people that offer the service.
The government is set to launch universal health coverage in Kericho County, and solving human resources for health issues will be key in implementing universal health coverage.
In the previous government, when we tried to implement the universal health care, and we left some orphans, some 8,000 or so orphans who were trained on UHC. And now, and a senator, that is something I would really want you to discuss within the Senate, and I want to ask Council of Governors to also take it up. It does not make sense for us to go out there and recruit somebody when there is somebody who has been trained, we have invested in that person.
The second challenge is training, retooling, and personal development. The third is staff welfare and career advancement. The fourth is performance management and motivation. And the fifth is healthcare worker safety and well-being. It is incumbent upon us to collectively identify the most pragmatic solutions to address these and other challenges.
President William Ruto is expected to assent to law the new 4 health bills with the fulcrum of implementing universal health coverage set to be launched on Mashujaa Day this coming Friday. This will ensure that every Kenyan has equal access to healthcare services. Belden Waliaula, Kericho County.